Today's video is going to be talking about Sjogren's disease. We classify Sjogren's disease as a connective tissue disease. What this means is some individuals who have a genetic vulnerability within their immune system trigger that vulnerability. That could be an episode of stress or it could be an infection. Once that vulnerability has been triggered, the immune system starts to attack tissues that hold us together, the connective tissues. There are many different types of connective tissue diseases, and they involve different parts of the immune system. In Sjogren's disease, the attack is towards the exocrine glands. These are glands that produce secretions. So what that means for our patients is that areas like tear production and saliva production can be impacted. So how do patients with Sjogren's disease present to me in the clinic? They might present because of severe dry eyes and gritty sensation in the eyes. They might present because of severe dry mouth, cracked mouth and other issues. But frequently they present because they have associated symptoms like severe fatigue and joint pains. I also see patients because they've been referred, for example, from our colleagues in the IE department, or they've been referred by ear, nose and throat doctors who have noticed there's dryness and are wondering if this could be caused by an autoimmune complaint. So when we make our assessment, we will look into your symptoms, how long they've dated back, and also whether there could be something else that's causing these symptoms. So, for example, smoking does not help with dryness in the mouth or eyes, and some medications can cause you to suffer dryness in the mouth and eyes. It's also quite a common set of symptoms. Fatigue is common, joint pains are common, dryness in the mouth and eyes are relatively common. So during the assessment, we might want to objectively assess if you have difficulties with tear production. So there's a test called the Schirmer's test. It's not the nicest test in the world. You pop some sterile filter paper into the eyes and you just measure if you can moisten the filter paper and how many milliliters you can moisten it in a number of minutes. If you're not moistening the filter paper, we know that tear production is significantly reduced. Probably assess for other joint problems because Sjogren's disease can present all by itself, but it can be associated with other autoimmune complaints. So you may get Sjogren's disease alongside things like rheumatoid or alongside conditions like systemic lupus erythematosus or SLE. The next phase is to see if you have any blood markers that point towards Sjogren's disease. And we have identified certain antibodies that are found in this condition. This will start with an antibody called the anti-nuclear antibody, which helps to identify a range of different connective tissue diseases. And then we may look at some more specific antibodies, part of the extractable nuclear antibody series, in particular one called SSA and one called SSB. These are known as Rho and La antibodies. We may also check your overall level of antibody production by subclass, and particularly high levels of the subclass of IgG are common in Sjogren's disease. So if we have the antibodies of Rho and La, you have dryness in the mouth and eyes, or maybe you have a positive Schirmer's test, joint pains and fatigue, that may well be enough to make a diagnosis of Sjogren's disease. If for some reason the tests are not coming back as positive, because of the commonness and frequency of these symptoms, we may need some more objective measurements to try and rule in or rule out an autoimmune problem as a cause. We can test how much saliva you produce by a test called scintigraphy that uses nuclear medicine scanning to test the function of the glands. We might perform an ultrasound over areas like the parotid that could show that the parotid has got evidence of atrophy. And finally, it might be helpful to do a biopsy test, taking a sample of tissue, for example, in the lip, looking under a microscope and seeing whether there is an immune attack on these areas that are producing the saliva will give a greater degree of certainty that you are suffering from Sjogren's disease as a cause for your dryness, as opposed to something else. Okay, so we now have identified your symptoms, we've worked out if it fits to Sjogren's disease, we've probably investigated and screened whether that is Sjogren's disease associated with other connective tissue diseases or Sjogren's disease all by itself, and we've confirmed it with the investigations. What are we going to do about it? Well, symptomatically, we will give you options of saliva substitutes, for example, eye drops or mouth spray that contains things like hyaluronic acid that can help to lubricate the mouth. Sometimes we give stimulation drugs that tries to stimulate saliva production, things like pilocarpine. They can have some side effects though. And to treat the underlying autoimmune process, hydroxychloroquine is a common drug to be issued. If you'd like more information on hydroxychloroquine, the benefits and the risks of that, you can check out the medications section on the website. Hydroxychloroquine may help with some of your symptoms, but often things like the fatigue remain quite challenging to improve over time. Is there anything else that you should know about Sjogren's disease? Well, the only other main thing is that most patients have what I would call very irritating, very bothersome Sjogren's, rather than very severe, life-threatening Sjogren's. But even those who have Sjogren's that causes discomfort from dryness in the mouth and eyes and joint pains and fatigue, they should be aware that a check with a doctor on a regular basis is important. This is because Sjogren's can increase the risk of some rare blood cancers. Now, that still means it's unlikely you'll get them. They still remain very rare. Doesn't mean you have a high chance of having things like a lymphoma, but your probability of some types of blood cancers can increase with Sjogren's disease, and regular monitoring on a once-yearly basis is sensible for that reason. Also, because it's possible that you can move from this type of Sjogren's that's causing life challenges to this type of Sjogren's that can be causing more substantial damage to the organs like the lungs. It's another reason why a regular follow-up, typically on a once-yearly basis with a rheumatologist, would be advisable. I hope you found the video on Sjogren's as helpful. Do you think I've missed anything off? Is there anything else that you would like me to have covered? Do feel free to leave me some comments. If you found it helpful, give me a like or a share, as it can help with the channel's visibility. Thank you.